The heart, pericardium, and mediastinum. Question 1. The phrenic nerves innervate the A. Diaphragm, B. Diaphragm and parietal pleura, C. Diaphragm, parietal pleura, and pericardium, D. Diaphragm, parietal pleura, pericardium, and intercostal muscles. Correct answer is C. Diaphragm, parietal pleura, and pericardium. The phrenic nerves have a sensory component as well as the obvious motor component supplying the diaphragm. The sensory component innervates the mediastinal parietal pleura adjacent to the heart and its covering pericardium. Question 2. The coronary arteries. A. Arise from the arch of the aorta and fill during diastole. B. Arise from the ascending aorta and fill during systole. C. Arise from the arch of the aorta and fill during systole. D. Arise from the ascending aorta and fill during diastole. Correct answer is D. Arise from the ascending aorta and fill during diastole. The coronary arteries arise from the ascending aorta just above the semilunar aortic and pulmonary valves. They fill in diastole because the coronary vessels penetrating the myocardium are compressed during systole so blood cannot flow into them. Question 3. Which statement concerning the atrioventricular bundle is correct? A. It is formed of autonomic nerve processes and is the only electrical connection between the atria and the ventricles. B. It is formed of Purkinje fibers and is the only electrical connection between the atria and the ventricles. C. It is formed of autonomic nerve processes and forms one of several electrical connections between the atria and ventricles. D. It is formed of Purkinje fibers and forms one of several electrical connections between the atria and ventricles. Correct answer is B. It is formed of Purkinje fibers and is the only electrical connection between the atria and the ventricles. Statement I is false. The AV bundle comprises Purkinje fibers formed from modified cardiac muscle cells. Statement 2 is true. The atria and ventricles are electrically isolated from each other by the non-conducting connective tissue forming and supporting the atrioventricular valves except where the bundle pierces it. Question 4. The right common carotid artery is a branch of A. The ascending aorta, B. The aortic arch, C. The brachiocephalic artery, D. The right subclavian artery. Correct answer is C. The brachiocephalic artery. The common carotid and subclavian arteries branch from the aortic arch. On the right, the single brachiocephalic artery branches into the right common carotid and subclavian arteries, whereas on the left side the two vessels are direct branches of the aortic arch. Question 5. In the fetus, the ductus arteriosus passes blood from the A. Pulmonary vein to the aorta, B. Aorta to pulmonary vein, C. Pulmonary artery to the aorta, D. Aorta to the pulmonary artery. Correct answer is C. Pulmonary artery to the aorta. The ductus arteriosus connects the aorta and pulmonary trunk. Oxygenated blood returning to the right atrium needs to be transferred to the left side of the heart for rapid distribution to the organs through the systemic circulation without passing through the non-functional pulmonary circulation. Blood which does not pass through the foramen ovale between the right and left atria passes from the pulmonary trunk to the aorta. Remember that the large vessels carrying blood from the heart to the lungs are still arteries despite the fact they are conveying deoxygenated blood.